I am so horrified when I listen to the nightly news and the media overall speaking every single day of terrorists that actually kill and hurt people all over the world. Today, I want to talk to you about a much greater terror that is occurring right here, closer to home, affecting our brothers and sisters, our family, and potentially even being a victim ourselves. Welcome to the BARM Nutritional Video Series. My name is Dr. Pauline Tai. I am the chairman of this wonderful organization. I want to talk to you today about the reports by the American Heart Association that every 34 seconds, another heart attack is being right now experienced by a man. Every 40 seconds, another heart attack is experienced by a woman in America. Every minute, a man and a woman will die in America from a heart attack. This is the largest single killer of Americans. We have been succumbed by this terrible disease that has affected all of us. I remember very well when my brother, a good-looking, young 43-year-old, who, after getting a clean bill of health from his cardiologist, having done all of the tests, all the bloods, and all of the treadmills, they told him that he was fine. And yet, I tell you that within 30 days, there was a massive heart attack and a sudden death where he was actually in rigor mortis before the ambulance even arrived. I'm saddened that all of us have stories just like this. And my family has been deeply affected by my brother's death. These can be prevented, and we should be looking for very specific markers that potentially can give us a preventive measure of what to do for those situations. Remember that the number one killer for women is not breast cancer, because it only affects women 1 in every 30 women. But the largest killer for women is heart attack. It occurs to 1 every 3 women. So what I want you to understand, hundreds of thousands of women die every single year with heart disease. Those are problems that we should address and make very clear steps on how to prevent it. I want to talk to you about the fact that the American Heart Association shows that 800,000 men will have a coronary accident this year. And out of those, somewhere around 500,000 will have repeated heart attacks. Those who already have heart disease, who already has had the open heart surgery and the stents, and now is having another one. So therefore, just because your doctor has performed a miracle surgery that has saved you, it doesn't mean that you are out of the woods. You need to continue to make all of the different preventive steps for you to actually protect yourself. I want to talk to you about the fact that the blood clots and the deep vein thrombosis are also a major problem. Remember that 1 every 5 minutes, there's a man and a woman having a deep vein thrombosis. These are clots that break away from an inflamed leg or within an airplane or from sitting in the car too long or just from sitting around watching TV too long. And what happens is that these clots break away and create an embolism to the lungs. They are killers. And I want to talk to you about the complications of these because it creates an embolism and it is a massive complication to thousands of Americans where you can actually, knowing the signs, prevent this problem. So the first and important sign of a deep vein thrombosis is really the pain on the legs, the pain on the calf, the swelling, tingling sensation, and potentially a numbness. Now, many people confuse muscle cramps as just, oh, I'm just having another muscle cramp, but it isn't. It is actually a deep vein thrombosis ready to blow up on your face. So what I want you to understand is that you need to know the signs, squeeze your calf. If there's a pain, go to the hospital, see your doctor as soon as possible. Because this is a problem that can recur, and 33% of our patients have recurrence problems, as well as these complications from either surgery or from inactivity. So what I want to talk to you today is the fact that you can run tests such as an ultrasound on the carotid arteries, where you can actually do a calcium score, where we know how much of that blood vessel in the carotid artery is actually affecting all your blood vessels. Because the carotid artery is only the one that you can actually see and feel and actually do a test. When your carotid arteries are showing blockage, then we know that same blockage potentially is occurring in your coronary arteries of your heart. This is a major possible complications that you should be aware of and take it seriously. The next is to make sure that you are doing the exercise, that you're moving, you're controlling your blood pressure, you watch for your cholesterol, and primarily your diet. Now, what I want to talk to you about today, most importantly, is that there are a number of very important supplements that you can also take advantage of. And these are wonderful in terms of both for the coronary artery, cleaning them up, as well as for the deep vein thrombosis and preventive of any kind of an embolism. The number one is Clot Buster. These are a formulations that we have prepared using the best references and the scientific research. What are they? They are made from nattokinase. These are beans that we eat. The Japanese eat for breakfast every single day. Now, I don't like the taste of it, so therefore I don't eat that for breakfast. And most Americans will not eat it because we are not accustomed, and our culture does not have that kind of a dietary supplement. However, you can take a capsule using the nattokinase as well as serrapeptidase and the lumbrekinase. These are special enzymes that cleans your blood vessel, that cleans up the clots, prevents any coagulation in your blood vessels so that you do not end up with a stroke, with a heart disease, with a coronary, or for that matter, with a deep vein thrombosis. The second part of it that I want to talk to you about is the fact that there is a new way of which to clean the blood vessel. This new way is a very interesting but ancient Chinese secret. There is an extract from a mushroom, and this mushroom is a woodsy type of mushroom that grows under the trees in Asia. This is called reishi mushroom. But now, however, Americans make the mistake of actually eating the reishi powder. Now, that is a huge, big mistake because the Chinese have known for thousands of years that the reishi mushroom is actually a piece of wood. Now, unless you're a cow and I don't know about it, you don't have 4 stomachs and you cannot digest wood. So therefore, for Americans to spend thousands of dollars buying reishi powder, thinking that and taking that, thinking that it does some good to you, is poppycock. So what we Chinese have been doing for 1,000 years is that we actually extract from the woodsy mushroom the actual polyphenols and the vibrant compounds naturally that actually can restore the membrane of every cell, including your arteries. So what does that do? Is when you restore those membranes, it also restores the inner lining of the blood vessels of your heart and throughout your body. What is the actual outcome? When you restore that inner lining, then no longer do you have the problem of inflammation on the cellular level, and therefore you actually are going to clean up all of those atheromas, those arterial plaques. And this is a wonderful new approach that is a breakthrough on cleaning up your blood vessels. I come from a family with heart disease. My mother with 2 open heart surgery. My brother, I just shared with you, with a massive fatal heart attack in his 40s. My father also did in his late 30s. My other brother having an open heart surgery in his early 30s. So I was very much conscious the fact that I potentially would have a massive heart attack on its way to meet me someday before the age of 50. So what I've done is have performed a number of steps that prevent this problem, and I am sharing with you so that you also can take advantage of it. Using the royal linseed extract, this mushroom extract, it cleanses the blood vessels as well as reorganizes the inner lining of the blood vessel. The third step to this is a opening of the circulation, opening of the blood vessel, opening of the coronary, increasing the total circulation. That obviously should make sense. The more circulation, the more life it has, and the less you're going to have a potential of having a heart attack or a deep vein thrombosis, or for that matter, a pulmonary embolism. Opening those blood vessels is the key. As a surgeon, I can tell you that the more circulation you have, the more health and life you will have. So using a natural watermelon extract with citrulline, this increases your circulation all over your body by over 37% within 40 minutes. So I will share with you that the third step to this whole entire preventive protocol is to increase your circulation. The fourth and the last one is to share with you about the vitamin B12. The power of the vitamin B12 is absolutely incredible because it methylates, it works on the level of the blood vessel, it works on the level of the nerve, as well as it works on the level of the red blood cells. What it does essentially, ladies and gentlemen, is that when you take the special B12 with the intrinsic factor, then what it does is to create for you, for the first time, a normal lowering of your toxics that are in your body. These toxicities are called homocysteine. These increase the heart attack and the deep vein thrombosis potentially by 500 to 800%. So lowering the homocysteine toxins in your body by using methylation is the B12 that is the kind that is a high quality. Do not, under any circumstance, buy the cheaper cyanocobalamin, which what Americans want to buy. Cheap does not mean good when it comes to your health. I tell you that methylcobalamin, using a special German nanotechnology that actually makes the intrinsic factor bioavailable so that this vitamin B12 can actually be absorbed in your bloodstream. The problem that most Americans have is that they don't understand that just because you put it in your mouth, it does not mean that it actually is absorbed by your body. And what I want for you to understand is that the biochemistry of effective bioavailability of your body actually utilizing this essential vitamin with folic acid, with vitamin B6, with vitamin B12 is key for you to actually stop the toxicity in your body and actually start the wonderful recovery, the steps on prevention and the steps on cleaning up your blood vessels. I will tell you that these are simple steps that you can actually take in order for you to prevent these atrocities and these terrible deaths in your family, like the one that occurred in mine. And they may just be able to save your brother, but most importantly, it also may save you. Until the next time, this is Dr. Ty signing out on the nutritional video series.